And over the years, my knee it deteriorated to the point where I got out of shape and can't do the things that I'd like to do. I don't think I'm gonna be dancing anytime soon. I used to make like a real loud crunch noise. My son used to say, make it sound like popcorn. You know, the 3-year-old used to say that. And so I would do that for him, but the popcorn maker's now not there.
I've had a lot of questions and inquiries about custom total knees. And in my hands, a custom total knee allows me to restore that patient's anatomy as close as human technology can allow. It helps me correct deformity, it helps me change the wear and tear that person subjected their knee to over the course of months and years. ConforMIS is the tool that's allowed me to do that. In the beginning of the process, we get a CT scan that not only gives me a three-dimensional model of your bony anatomy at the knee, but also includes the mechanical and anatomic axis of the whole leg above and below, because I want to be able to correct not only the arthritis, the disease, the deformity, but any angular wear that's occurred. You know, the CT scan in hand, the ConforMIS engineers start plotting out potential positions and anticipated resections, and they send me a roadmap to the success of your surgery that I get to start looking at beforehand. And this comes in and I'm already given a digital readout of where I would anticipate your patient-specific cutting jigs. These jigs will only fit your anatomy because they are made and would not fit anyone else, just like a fingerprint. If this implant is made to your bone, rather than having your bone trimmed to match an implant that already exists, I'm having to make much finer and less resection to your bone. Effectively, I'm not cutting your round peg to fit a square hole somewhere. I'm giving you the round hole that your round peg deserves.
Whatever you guys put in here feels natural. It doesn't feel foreign to me. I've got the range of motion that I had before, and it doesn't make that, I think we said before, the popcorn noise. It doesn't make any noises, so I think it's a good choice.
And it's not preventing him from doing the things that he'd given up beforehand, the activities that he would have loved to do but chose not to because he didn't want to deal with the ache and pain and swelling and discomfort in the days that would follow.
Now it's every bit as good as the other one. I don't have to worry about it. Things you want to do, you got life to live still. You know, I would say, you know, by all means, go for it. I love it.
Being able to restore what one has lost should be the goal, and that's what ConforMIS allows me to do. All of this equates to some of the art in addition to the science of applying an implant that can only fit you in a way that's going to benefit only you.